Analysis by a professor of environmental medicine from the NYU School of Medicine, Dr. George Thurston, who looked at the differences in the pollutant concentrations being measured at the Globeville monitor down the road here, near the highway in the neighborhood, and other parts of Denver. And what he found was that the higher concentrations being measured in these neighborhoods accounts for the reason why the city of Denver showed that the cardiovascular disease in these neighborhoods is much higher than it is in the rest of Denver. We're talking about 213 cardiovascular deaths per 100,000 in these neighborhoods and 160 in other parts of Denver. That's a big difference. That difference, CDOT was asking earlier, without doing any analysis, perhaps that can be accounted for by other causes. And so we had to go out and find an expert who would analyze the data and determine that, in fact, those pollution levels account for that difference. It's not some other cause. But what that means is that as we go forward and more pollution is added to the neighborhood, there are going to be more deaths from cardiovascular disease. And there's going to be more kids with asthma, and more asthma episodes, and more kids losing time from school because of asthma, and then falling behind in their studies, and ultimately dropping out of high school because they've fallen too far behind. I mean, these kinds of consequences for a community were totally covered over by CDOT. So we've had to bear the burden of finding the experts to tell the court what is going on here. And basically what it comes down to is the law requires the federal government to make what's called a public interest determination. They haven't done that. And they can't do it without telling the community how many more funerals you're going to have to go to in the future as the pollution increases, and how many more kids are going to end up with asthma and dropping out of school. That's the kind of information that needs to be part of a determination of whether or not this project is in the public interest. And the other part of it is mitigation. The mitigation that they've put in this project is only during construction. They've not adopted any mitigation for the future long-term protection of the community. So when they talk about mitigation, and they tout it everywhere they go, that it's all going to be fine. But it doesn't address the long-term exposures. And during construction, it's not going to be adequate either. During construction, they're saying they're going to move 3.9 million cubic yards of dirt and debris from taking down this viaduct. That's going to take 195,000 haul truck loads to move that material through the neighborhoods. Those truck trips are going to add a lot more pollution. And another study that we introduced yesterday to the court was an analysis showing that the pollution levels during construction, which is going to last for 4 years, will be higher than the pollution levels they modeled for 2040. So in 2040, they're saying the pollution from the traffic is going to barely comply with the National Air Quality Standard for larger particles, PM10. But what we showed was that the pollution emissions during construction will be even higher than that, which they completely ignored. They didn't address that at all in terms of telling the community what the exposures are going to be. And the last thing that we did yesterday was submit a modeling analysis for what are called fine particles, PM2.5. Those are the pollutants that EPA has called out as being responsible for more air quality deaths than any other pollutant in the country. That is the contaminant that accounts for most of the cardiovascular diseases, according to EPA. And we asked CDOT during the comment period to do an analysis of whether or not the future emissions from this project would cause the National Air Quality Standard for that pollutant to be violated. They refused to do that. They didn't want to know. So we hired a modeling expert to take the EPA guidance documents and apply them to this project to determine whether or not that standard will be violated. And that analysis shows the standard will be violated. This could potentially turn the Denver metro area into a non-attainment area that would trigger all the planning requirements under the Clean Air Act, that would limit the permitting of new industrial sources, that would require a new transportation plan for the city to reduce the pollution on I-70 in order to bring the area back into attainment. And that information was not generated by CDOT. We had to do it. So this is the kind of information that we now have presented to the court. And this is what we've asked the court to consider as part of its review of what was done here. Basically, they've covered up all of the consequences for the community in terms of human health. This is a human health sacrifice area. It's already been happening as a result of 50 years of exposure to this pollution. But the pollution will be worse. That much we know. But what they don't account for is how many more funerals you're all going to have to go to. And that should be known and should be revealed so that this can become part of the public discussion about what needs to be done in these neighborhoods. And one of the things that I think the neighborhood needs to do is ask the next governor to come and meet with you and say what's going to be done to protect health and kids and schools in these neighborhoods.